Now, the health workers' strike scheduled for Friday is still on. The caucus of health workers associations cited inaction by the Ministry of Health and the Council of Governors in addressing their grievances and cautioned those seeking treatment at public hospitals from that date to seek alternative means. Top on their demands was the absorption of universal health care workers into permanent and pensionable terms and harmonization of their terms of employment.
Services across public hospitals are said to be paralyzed beginning Thursday midnight when the 60-day strike notice by health workers lapses. The health workers are demanding absorption of universal health care workers into permanent and pensionable terms, harmonization of terms of employment, timely completion of the collective bargaining agreement, and recognition for respective unions.
We want these people on permanent and pensionable because we want their terms of engagement to be harmonized with their equivalent who are serving in the same ministry. What is happening is that the Council of Governors continue to advocate for extension for 3 years against the advisory of the Public Service Commission. For the last 7 years, the healthcare workers have not experienced any gain in terms, or rather financial increment in terms of their payment. So we are urging that there must be a consideration.
Tuko na mambo kidogo ambayo nataka tukutane na tumalizie recognition agreement ya vyama kama hivi vyetu. Tuko na vyama miungano zaidi ya 4 ambayo ina recognition agreement na tuweze kukaa kwenye meza kama tuna recognition agreement.
The health workers lamented that efforts to get audience with the Minister of Health and the Council of Governors have proved futile.
The employers have decided to go on strike and they have decided we must join them. So it's very unfortunate that we have to inform Kenyans that from Friday you will have to seek alternative services from the private sector because the public facilities will not have any of the officers to provide the health services.
Among the health workers said to go on strike are clinical officers, environmental health and public health practitioners, pharmaceutical technologists, nutritionists and dietitians, medical laboratory officers, among others. Despite vowing to paralyze services across the public hospitals, the healthcare unions have maintained that they are still ready for negotiations should their employer reach out before the lapse of the 60-day notice on Thursday midnight. Meanwhile, health workers in Machakos County have issued a 6-day strike notice demanding a conducive working environment, citing shortage of staff and stagnation in job groups.
Without a serious, meaningful engagement from the same county government that we have now engaged for over 1 year plus without any tangible result, then it is unfortunate. And our members have given us a very stern warning that they shall take themselves to strike even without our command.
Unapokwenda hospitalini na upati madaktari wa kutosha, basi unaketi pale kwa muda mrefu sana ukingojea huduma, na hilo si jambo mzuri.
Time is up. Our members have refused. It is time to go on a strike.
Nancy Okware, Prime Edition, Nairobi.